Question number 1. The first step in the nursing process is. The right option is option B, assessment. Question number 2. The purpose of nursing assessment is to. The right option is option A, identify patient problems. Question number 3. Data collected directly from the patient are called. The right option is option B, subjective data. Question number 4. Data obtained through observation and physical examinations are. The right option is option A, objective data. Question number 5. The best source of primary data in nursing assessment is. The right option is option C, the patient. Question number 6. Which of the following is a component of nursing assessment? The right option is option A, collecting data. Question number 7. During assessment, inspection means. The right option is option C, observing visually. Question number 8. Palpation is performed to assess. The right option is option B, body temperature, texture, and tenderness. Question number 9. A rapid, weak pulse may be a sign of. The right option is option C, shock. Question number 10. The technique of using the sense of hearing to collect data is called. The right option is option C, auscultation. Question number 11. In nursing assessment, data validation means. The right option is option D, verifying accuracy and completeness of data. Question number 12. The nurse documents the patient pain is sharp and continuous. This is an example of. The right option is option B, subjective data. Question number 13. Which of the following is not a method of data collection? The right option is option C, diagnosis. Question number 14. Which phase of the nursing process includes assessment? The right option is option D, initial step. Question number 15. A nurse observes pale skin and rapid breathing in a patient. These findings are. The right option is option A, objective data. Question number 16. Which of the following best describes a focused assessment? The right option is option B, assessment limited to a specific complaint or problem. Question number 17. A nursing assessment must be. Right option is option D, systematic and continuous. Question number 18. Which statement about subjective data is true? The right option is option C. It is based on the patient's perception. Question number 19. The best tool for data collection during assessment is. The right option is option C, assessment checklist. Question number 20. The ongoing assessment done during every patient contact is called. The right option is option D, ongoing assessment. Question number 21. When a nurse checks a patient's vital signs, it is part of which step? The right option is option A, assessment. Question number 22. A nurse assesses that the patient's pulse is weak and thready. This findings is. The right option is option B, objective data. Question number 23. While assessing a patient's abdomen, the correct order of physical assessment technique is. The right option is option C, inspection, auscultation, percussion, palpation. Question number 24. Which of the following is considered as secondary source of data? The right option is option D, laboratory results. Question number 25. A nurse notices that the patient's skin is warm, flushed, and dry. Which part of assessment is this? The right option is option B, objective data. Question number 26. The nurse asks, when did your pain start? This is an example of. The right option is option B, close-ended question. Question number 27. The best example of a focused nursing assessment is. The right option is option B, checking blood pressure in a hypertensive patient. Question number 28. In the nursing process, assessment is primarily based on. The right option is option D, data collection and validation. Question number 29. Palpation is used to assess which two properties of a pulse? The right option is option B, rate and rhythm. Question number 30. Which of the following describes comprehensive assessment? The right option is option C, complete review of physical, psychological, and social health. Question number 31. During assessment, the nurse should first establish. The right option is option D, rapport and trust. Question number 32. The nurse observes that the patient's speech is slurred. This is an example of the right option is option B, objective data. Question number 33. The nurse verifies the accuracy of collected data before recording. This process is called. The right option is option A, validation. Question number 34. The patient states, I feel so weak and dizzy. This information is categorized as. The right option is option B, subjective data. Question number 35. In nursing assessment, the most reliable indicator of pain is. The right option is option B, patient's statement. Question number 36. During assessment, a nurse uses inspection, palpation, percussion, and auscultation. These are known as. The right option is option D, physical examination techniques. Question number 37. Data that only the subject can describe, land, verify is known as. The right option is option C, subjective data. Question number 38. What is the first step in the physical assessment of any body system? The right option is option C, inspection. Question number 39. A blood pressure reading of 150 by 95 mmHg is what type of data? The right option is option D, objective data. Question number 40. For which body system is the sequence altered to inspection, auscultation, percussion, palpation? The right option is option D, abdominal. Question number 41. The primary source of data for a nursing history is the. The right option is option B, patient. Question number 42. On a scale of 0 to 10, what is your pain is an example of what type of question? The right option is option C, close-ended question. Question number 43. An assessment performed to identify a specific problem is called a. The right option is option C, focused assessment. Question number 44. The process of confirming the accuracy of assessment data is called. The right option is option B, validation. Question number 45. A body temperature of 38.5 degrees centigrade is considered. The right option is option D, pyrexia. Question number 46. The nursing diagnosis is formulated during which phase of the nursing process? The right option is option B, diagnosis. Question number 47. Data collected from a family member is considered what type of source? The right option is option C, secondary source. Question number 48. A bluish discoloration of the skin indicating hypoxia is called. The right option is option C, cyanosis. Question number 49. The most reliable indicator of a patient's pain is the patient's. The right option is option D, self report. Question number 50. The sound produced by percussing over a felt organ like the liver is. The right option is option D, dullness.